Hello, dear listeners, and welcome to the Overcoming Your Story podcast. This week, our guest is a young woman, a doctor from Nigeria. Her name is Doyin Anibaba. So I will not introduce her more so that you get the pleasure of hearing her introduction in her own words. Yeah, hi, Doyin, and welcome to the podcast.
Hi, thank you so much for having me. I'm so glad to be here. Thank you. My name is Doyin Anibaba. I'm a medical doctor and I have particular interest in mental health. So I love to raise awareness about mental illnesses, mental health struggles, debunking a lot of myths about mental health and just educating people in general about the importance of mental health and also reducing the stigma associated with mental illnesses. So basically, that's what I'm passionate about doing. And I also have some experiences in offering counseling to patients, online and offline. I've also been part of different volunteering projects that has been to raise awareness about mental illnesses. And I've also been on TV, on radio, just in this bit to raise mental health awareness.
That's really amazing. To start with, do you have a main message you would like to our listeners to take away today?
My main message that I would like people to take away is that whenever you feel like you're struggling with your mental health, it is okay to ask for help. It is not a sign of weakness to ask for help. It is very, very okay. Because I find that a lot of people they don't they're not very comfortable seeking help when they're definitely struggling. So I just want to tell anyone listening out there that if you're struggling with your mental health, it is very okay to ask for help because help is available everywhere, online, offline, anywhere you look, there's help available. And when you get that help, you find that you feel better. You will be much better.
Yeah, it's a very important message coming from a context where when we struggle with our mental health, there's so much shame around that people tend to hide and pretend and suffer in silence. And there's no need for that. That's a powerful message. So to start off with you, how did you grow up? Can you tell us a little bit about your childhood? You're a doctor. Tell us a little bit about all of that.
Okay, so for me, growing up, I've always been, interested in the things that have to do with the human mind, psychology, all of that stuff. I remember one time when I was a teenager, I was reading a book about, personality tests, knowing much more about your personality type and the different types of personalities. And I really found it very intriguing. So when I was much younger, I would just find myself reading all these books about, psychology and the human mind. And then I went to medical school, and the post in the rotation that I enjoyed the most was my psychiatry rotation because I just enjoyed it because you know how in medical school you go through different rotations, pediatric surgery, OBGYN and others. But for me in med school I found that I really enjoyed my psychiatry posting, and so for me, that was how the interest has always been there when I was younger, and then going to medical school, enjoying my psychiatric posting. So that really just reinforced the interest and the passion for mental health for me. And then after graduating, I decided to just keep educating people about their mental health, and I find it very interesting, and I enjoy doing it.
So, but did you have a role model? How come you had these books about psychology already when you were younger? Did you have?
Yeah, my mom has some of these books at home because she was doing her masters in psychology then. So she had those books on the shelf, and then that was I was just look at the books and just read them. So I guess because the books were available, I found them and I read them.
How come you decided to study medicine?
Oh wow. My decision to study medicine, it's not. I don't know. I enjoy helping people. I really love helping people. So that's where that came from. The fact that I love to help people I love to, just help people basically. Yeah.
This profession, around mental health, mental awareness, it always comes from people who have this deep desire to help others. Yeah, find freedom, understand themselves better. Um, I saw you created a platform for that. You have, I pronounced it correctly, the Wellforte.
Yeah, the Wellforte. Yeah. So it's been a while since like I said, I've been interested in mental health and awareness. So it's been on my mind to start a platform online that would do that. So it took me a very long time before getting the name. And even when I got the name, I was like, I don't know if it's nice. When you're just second guessing, you're just not sure if this is the name, because you hear some business names and you're just like, wow, this is so creative, this is so good. So I was just like, um, I wasn't sure if I should go with it. But when I felt like I was stalling too long just because of the name, I decided that, you know what, I'm just going to start with this name. If I get inspired to change it later, I can easily do that. Or if I get a better name later, I can easily do that. But I just said, you know what, I'm just going to start with this. I don't want the name to be what would stop me from raising the awareness and doing what I really feel I should be doing. So I just started back then in 2019. I'll just post one or two things and then, yeah. So that's it. That's how the name came about.
What's the meaning behind the name?
Oh, yeah. So fort is like a space, like a safe space or environment. So I just went with the well fort. So it's just like a place where you feel safe, you feel well in your mind, in your soul, in your body. So that was really where it came from, just like a, a fort, like a little, safe haven in that sense, like a safe haven. Yeah.
I mean, when I read the name, for me, it evokes something very positive. So I think, I'm happy you're a professional. You're a doctor, and I know in the future you want to specialize in psychiatry, right?
Psychiatry. Yes, yes. That's
Wow.
my plan.
Ah, we're so lucky. Once, because it's important to have as many specialists as possible who understand context, who understand culture, who understand, to raise awareness towards this well-being that we want as many Africans to have access to. So, in your work so far, what are some of the myths and facts about mental illness? Do you want to talk about that?
Okay, yeah, yeah. There's so many. There's so many myths out there about mental illnesses. One of the most common ones is that people believe that mental illnesses are not curable, especially coming from a background from Africa or Nigeria, where people that have mental illnesses, it's not really understood back home. So a lot of people think that mental illnesses are incurable, there's no solution for it. So, and I like to say right now that, you know, mental illnesses are very, very curable with the right kind of help. And when you treat any illness properly and appropriately, most people will fully recover from their mental illness. And then for the most times, some people have to get treatment continuously for the rest of their lives. Just like, for example, if someone is diabetic or hypertensive, they have to be on medications for the rest of their lives to be able to manage that condition. So some mental illnesses are like that as well, where you need to be on medications for the rest of your life, or some are also the kind that you treat it for a while. Once you get better, you stop. But the summary is that treatment is available. Just as we have treatment for physical illnesses, we also have treatment for mental illness.
Yeah. And people are so scared to be associated with mental illness back home. It's the worst thing and it's good to have this message go through. And I mean, even people who are in the streets, I seen from in Cameroon, where they're naked or picking food from the ground, or all those people, if they had the right treatment, they wouldn't be there.
Exactly, exactly. And if they were also treated early, getting treatment early also really helps in the outcome of things. So getting early treatment is also very important. Yeah. So the next myth is, I'm going to try to relate the myths as much as possible to things that are common with the Africans, since we're both Africans and all of that. Another common myth is that people think that mental illnesses are, diabolic, or they have this spiritual attack, or it's um it's the devil, all this kind of, a lot of people try to paint mental illness as a diabolic thing, and that's not it. Most times, the main reasons why people come down with mental illness is because there's some imbalance in the chemicals in the brain. That's it. Nothing more than that. But you see that a lot of us, from West Africa, Nigeria, whatever, we tend to, spiritualize these things, that okay, the reason why he's depressed is because he offended somebody 10 years ago, and the person is trying to get back at him, or the reason why this person is, suicidal is because their parents or their grandparents offended some gods, and now the god is trying to punish them, and all those things are not true. The truth is, depression, if you look at it, depression, there's a pathophysiology. There's a reason why people get depressed. There are imbalances in the chemicals or neurotransmitters in the brain, dopamine, serotonin, oxytocin, and all of that. They're supposed to be balanced. But sometimes you find that, for maybe due to a psychological stress, or due to psychological stress, you find that those chemicals and neurotransmitters are not well balanced. And then eventually you find that the person will come down with depression, or schizophrenia, or bipolar disorder, or anxiety. So at the end of the day, you will see that there's actually a scientific backing for every single mental illness. And it's not that it's a spiritual attack or someone is punishing you and all of that.
I totally relate to what you're saying because I also advocate for childhood trauma awareness. And in the literature I've been reading so far, they say when you go through stress as a child and continuous stress, right? It could be I mean, there are many stressful situations. It could be from being beaten by your caregivers, being, I don't know, you don't have enough food, you're maltreated, no one's taking care of you, your parents are not with you, your a family member goes to prison. All that stress over many years has consequences, and it gets stored. And we when we grow up and we become adults, I mean, we don't know how to manage our emotions, and then we get adult stress and all of that. It can lead to depression in some like major how do you say transitions in life. I saw when I transitioned from school to work that I became depressed because I totally was like, what am I now? I finished school. What's my identity? Even becoming a mom. So it's very important to know things instead of thinking, oh, the grandmother insulted that other woman in the village. That's why everybody, you know, and then we try to hide it as a shame. We hide the person who has a mental health problem in the house. We shouldn't tell people because it is no, the person has a health problem. If the person broke their leg and they would take them to the hospital, it's kind of the same thing actually. That's the awareness we need to really bring that people you can seek.
Yes, you're very right. And I just want to buttress more about what you said. You know how you said that maybe when you were transitioning from being a student to graduating and working, there was that was a bit, too much for you. And the truth is, people handle psychological stress differently. You'll find that what would make someone else, traumatized or break down mentally, it will not affect the next person, the same way. So we need to all understand that we have different emotional resilience. So if you find that this particular issue for you is too much, you need to acknowledge that. And that's the only way you'll be able to handle it, as opposed to being in denial or trying to come up with, I'm strong, I can do it, and all of that. That's just deceiving yourself, and it doesn't really help. If you find that this particular situation stresses me, or or this thing gets on my nerves, or this thing really triggers me, you need to find a way to acknowledge that And that way you'll be able to find a solution. And that way you'll be able to better manage whatever is coming your way. But if you're in denial and you're pretending I'm strong, I can do it, but deep down you do know that you need help, you need support, then when the whole situation arises, you might not be able to handle it properly. And that can lead to, a snowball effect of so many things just happening and happening. So very good that you acknowledge that, okay, in this part of during this stage of my life, I found this a bit challenging. And that way you were able to, get help and get the support you needed.
What my family thought, because no one in my family has been to see a therapist. So for them, so, but why do you need a therapist? You don't need, you have us. I'm like, no, you're not therapist. Sorry.
Yes, yes. Another myth I would like to talk about is that a lot of people think that mental health challenges are not common. And they are more common than we know. Because if you look at so many statistics, you will be mind blown about how common mental illnesses are. So a lot of people just believe, especially coming from where we are, a lot of people just believe it's not common. Even if you have it, maybe you're pretending or you're lying or you're looking for attention. But we need to acknowledge the fact that mental health challenges or mental illnesses are very common, and they're even becoming more common nowadays. The other day, I was reading about a teenager on TikTok, that committed suicide, 18 years. And then I was like, I didn't even, someone told me about it. I was just, mind. But if you Google the number of teenagers, young adults that are committing suicide, you'll be mind blown because it's so rampant. It's so rampant. I still had another story a few days ago of suicide. That's how common these things are. Other mental illness is anxiety. A lot of people even have anxiety. They don't even know they have anxiety. They don't know they have anxiety disorders, and all of these things. So we need to acknowledge that mental illnesses are common. They are very common. And we need to, when we acknowledge that way we'll be able to show support to people that need it. But if we're in denial that it's not common, it's just 1 in 1,000, so it's not a big deal, we're not going to help anybody. But if we acknowledge how common and how popular these things are, we'll be able to show support to other people. We'll be kinder to other people, around us. We'll be more kind to the people we see around us. So that's what I would say, it's really common. If we search statistics of mental illnesses right now, you'll be surprised by the figures we see.
And also, the knowledge is becoming more and more democratized. We are getting more and more access to the knowledge we didn't have access to before. Even in the West, it took time for people to realize. I remember in the research for trauma in the early 80s, people thought that, for example, for sexual assault, it was like one child in 1 million in the US. And because people were just in denial that it's not possible that kind of thing could be happening, before they did some research and they realized that it was way more, it was not one child in 1 million, It took a lot of research. And even the fact that if you go through the stress in your childhood, it could set you up for you're more at risk of, I don't know, becoming addicted or getting depressed and things. These people did not know. And these are things that in our context, people should start getting, getting that knowledge. Because when you're depressed, they say, are you the first person to be depressed? Like they just, so if you're already suffering and someone shoots you down like that, well, you're not going to say anything anymore. And that's the isolation that actually hurts more than the illness itself, because without support, I mean, how are you going to cope? And then people do things and then they say, but well, why did he do that? And they people take their lives and then they even get blamed for what he didn't think of his. And it just shows how people don't understand how these things work, actually. Yeah. What other myth do you have for us?
Okay, so the last one I would like to talk about is that a lot of people think that therapy, medications are a waste of time, and that's not true. Therapy, so let's take for instance, if someone is suffering from an anxiety disorder, The first thing that will be prescribed to the person is therapy. So cognitive behavioral therapy, just to help the person work through the anxiety. And then if they do that for a while and it doesn't work, then they can now go to medications. But most people believe that therapy is a waste of time, and a lot of people don't even like to go to therapy because they feel that it will rehash some things they've buried. Some things they buried deep down that they don't want to revisit and all of that. So some people don't go to therapy because they're afraid of what they will find or what they will discover. Some also, they feel like it might not work. So there are so many reasons why people don't even go for therapy. But research has shown that it is very, very effective in treating mental illnesses. A lot of times, therapy alone can actually solve the issue. People don't know that a lot of times therapy alone can be the solution that the person needs. In some few cases, the person may eventually need to be on medications, which is okay as well. But the truth is, therapy alone can solve a lot of mental illnesses that people have. And also, anyone that goes to therapy, about close to between 70 to 90% of people that actually go to therapy, they will tell you that they've seen improvements in their symptoms, in the way they are feeling. So once people are able to overcome the hurdle of the fear of therapy, or the criticism they have of therapy, once people are able to jump those hurdles and go to therapy, they will find that in the long run it's beneficial. And also, I'd like to add here that you don't even need to have a therapist even when you're struggling. You can have a therapist when things are going well, someone you like to share your progress with, someone you like to tell about how things are going in your life. So it's not just about having a therapist because things are not going well. You can also have a therapist when things are going fantastic. It really just helps, talking to a professional about, things going on in your mind. And I understand the place that family and friends, their role. I understand their role. But at the same time, therapists are trained for these things. The same way you wouldn't go to your family member to help you fix your car, you go to a mechanic to fix your car. That's the same way we should go to therapists to talk about our challenges, talk about struggles, or even to talk about the good things happening, because they are trained to do that. Your family and friends will show you the support the best way they can. But at the end of the day, they're not trained and they're not specialists in that area. So it's good to just, you know, take the advantage of having the specialist and going to them and let them do their job. And also, medications work. A lot of people disbelieve that, okay, medication, psychiatric medications are just pills that make you happy, or pills for, people, there's so many misconceptions. But the truth is, like I said earlier, neurotransmitters and hormones are imbalanced in most of these mental illnesses. And what the psychiatric medications do is that they try to find a balance in these neurotransmitters and the hormones and everything. So that's what the psychiatric medications do. Some would reduce dopamine, some will increase serotonin. So they have different things they're doing. At the end of the day, they're just trying to achieve that balance that is supposed to be there, that's been disrupted for one reason or the other. So those medications are there to restore the balance, and they are very effective. You find that when you stick to your medication plan and you use it effectively, it will work. It works 100%. In fact, most times it works. But when people are skeptical, you see that they're not using the medications the way they're supposed to, they're skipping the doses, or they are hearing different things about the medication. This medication is a happy pill, is only going to be making you happy, or is an easy way out, or something. Those things are simply not true. The same way a diabetic would need insulin is the same way someone is who has ADHD, attention deficit hyperactivity disorder, will need their medication to help them with that condition. So that's it. So I just want us to know that therapy, medications, those things actually work. And for majority of cases, therapy alone can be the solution. If therapy alone doesn't work and you have to be on medications, that's okay as well. But just make sure you use the medication, and stick to your prescription, and you'll find that it will get better.
for example, if someone is depressed and they're on medication, it's still important to go to therapy to work through the issues
Yes, yes,
that actually brought them to that
yes,
depressed. Yeah,
yes. It is
because
true.
yeah, I mean the medication will stabilize you, but you still need to work through your issues.
Therapy, yeah, therapy. So the ideal combination is therapy and medication. It is very, very effective. But sometimes people that have mild symptoms, they can just do therapy alone. But if it's more severe, like more severe, therapy and medication is a great combination because so mental illnesses as well, there are different severities, mild, moderate, and severe. So mild. So just to explain it, so someone who has a mild um, condition, they will still be able to function. They'll still be able to do their job. They'll still be able to, do their everyday activities. But someone who has a severe or very, very severe mental health challenge, you see that the person will not be able to work. The person won't be able to, if they're parents, you see that they might not be able to do their parenting job properly. Even their work will be slacking, their physical hygiene and so many things. So you see that that's like extremely severe. So in those cases, you would recommend therapy and medications. So basically at the end of the day, the psychiatrist or the psychologist or the therapist will be the one to really prescribe the best solution for you based on how you're feeling. So it's not a one size fits all. Oh, my friend was depressed and then she went to therapy, she felt better. So how come I'm going to therapy and it's not working? It might be because the friend had a mild depression, which therapy works for, and then yours is probably more severe, which therapy will not work. So at the end of the day, it's not one size fits all. It has to be customized and made for each person based on how they're feeling, based on their symptoms, and based on the severity of the challenge they're facing. And also, sometimes people even have two or more, you know, mental health challenges at once. Somebody that has attention deficit hyperactivity disorder might also be struggling with addiction or might be struggling with depression. So some people have a mix of these things. So it's very difficult to say, oh yes, this is it. The same thing works for everyone. No, it's different. If everybody gets their own medication or treatment plan based on how they're feeling.
Yeah, yeah, you're right about severity and the type of help needed because it's very important to because for example, you can have mild depression when you go to therapy, but at some point maybe it becomes really severe and you cannot get out of bed, you cannot brush your teeth, you cannot take a shower. And now you have to have a different type of medication and they're working through the issues when you stabilize yourself. So it's important. Me, I think I functioned with depression since I was a child. The first therapist who told me that from what I'm describing, he thinks I've been depressed since I was a child. I never went back there because it was the first time I heard it was really very overwhelming. Yeah, when I transitioned to work, I was feeling so empty. I knew there was a big problem. So I started looking for help and everything. I went through different therapies. I could always function. I would force myself to go to work, but it was becoming really more and more difficult. But when I gave birth, all the unresolved trauma came back to me. So each time I have three daughters, each time I had postpartum depression. But the last one I had my third daughter in Canada. I didn't do like the other times where that's why I'm talking about all these issues because silence. I would stay silent, suffer in silence. That time, I told the doctors, I'm like, I've suffered twice from postpartum depression. I need help right now because I started depression during pregnancy. After pregnancy, I mean, as soon as I'm pregnant, it just becomes very severe. So they gave me help. It was in Toronto. Yeah, they had a program for women who were pregnant who had been through trauma in their past. So they had specialized help with a psychiatrist specialized in childhood trauma, and they had a therapist, like a counselor. I would see, and then I would see the psychiatrist. And from what she was like, with your symptoms, you should be on medication. But I didn't want to, I refused, but I kept going to therapy and everything. But after I gave birth, it just became worse. And for a few months, I went on medication. It was so good in stabilizing me. It helped me bond with my child better because I was more present, not out of my mind stressed like I was with my first two daughters. So I saw the difference in the way I experienced the postpartum too with my third daughter. And I still go to therapy. Therapy is not like speaking to your friend. It has nothing to do. Yeah. I had one of my uncles passed away. And when they told me, I had this pain in my face, like really like intense pain, also in my back. And when I talked to my therapist, I'm like, I don't understand. I had this pain in my face. The first thing she told me was like, did he ever hit you in the face? I was like, yes, he did. And it was that place that was hurting. Something from 30 years ago, It was so shocked. I'm like, a friend would never have. Oh, there's no way a friend would have, because maybe I wouldn't have even verbalized it that way. I did not know what was going on. But she, right on point, she's like, did he ever hit you in the face? And then, of course, it just made sense. I'm like, yes. And so, yeah, how the body remembers, it has a memory. I was like, wow, yeah. So it's very important to, and then you feel freer when you do this work.
I really like the fact that there's that support group for women who
Mm,
struggled. So that's really good because also having a community of people who has struggling with the same thing or similar thing with you really helps because that
mm,
way you don't feel all alone. You don't feel like you're the only one, and that alone, knowing that you're not the only one, is so helpful for your mental health. So I really like the fact that also with your third pregnancy, you decided to seek for help. You spoke up and you told them, "This is what happened. I need help," and that's really good because it's not everybody that can do that. So the fact that you did that, that's really really good. I mean, and the fact that you're sharing your story as well is really good. And I hope that someone listening would also be encouraged to seek help, or if they need help, and speak up so that they can be able to get the help and support they need.
yeah, I didn't suffer like the other ones. It was horrible, but this time I had like, even when I went for my prenatal visit, I would check in with they had like an on-site social worker. We go and check in with her for 5-10 minutes just to see how I'm feeling and everything. Yeah. And because I asked for help, that's the thing. Sometimes you don't know the kind of help you can have access to. If you don't say anything, no one can help you. So important. Because when I gave birth, they told me, because I suffered from postpartum depression in the past, they gave me a room by myself. Normally, you have to pay $400 a night to have a room by yourself. No, they gave me a room by myself. They told me I could stay there for 5 days. In the night, they would take the baby so that I would sleep. It was so good because I have two small daughters. And so in the night, at midnight, they will take the baby away. I will sleep, and at 6 a.m., they will bring the baby back. So I could sleep for 5 days before I went home. It made a total difference. But if I didn't say anything, they wouldn't have come and just, they don't say it because they say, okay, no, it's not for her. We're not going to tell her, right? But if you say, hey, this is who I am, this is where I'm at, then people will say, okay, we have solutions for you. And
For you,
yeah,
exactly. Exactly.
it's important.
Exactly. That's amazing.
So we can move on to the next segment, which is how we can show support to someone struggling with their mental health.
If someone comes to you and they tell you that this is what they are going through, this is what they're struggling with, the first thing is don't be judgmental. Listen, don't judge them. Don't say, oh, so is this the thing that is worrying you? It's not even serious. Or why are you being so weak and all of that? No, don't judge them. Just listen. Listen, show empathy, and do not judge them. That's the first thing. That's the very first thing that anybody, that's the least you can do. Then ask them, okay, when they're done sharing what's on your mind, okay, ask them, how would you like me to help you? Because the truth is, most of us are limited in what we can do. So, do you want me to go with you to a support meeting? Do you want me to, link you up with a therapist, or, follow you to a hospital at hospital appointment? How do you want me to help you? How do you want me to help you, basically? And also, you can also reassure them. You can also reassure them that and let them know that whatever they're struggling with, there's a solution for it and that they are not alone. Reassuring them alone will go a long way. Just tell them, okay, I might not really understand what you're feeling, but I know that there's a solution. You're going to get past this. And also, you're not alone. You know, so many people also have this challenge. You're not alone. You'll get past this. Those are ways that you can, you know, show them support. Also,
Yeah.
don't confront them and compare them with other people, because saying stuff like, okay, I know somebody too. She had the same issue, but her own was not this bad. So why can't you just man up, or just, all those kind of things? Confronting them, being confrontational is not going to be helpful.
Talking about judgment, why do people judge? Because I always really wonder about that. I feel as if it's either it threatens something in them, you know, to hear someone like someone has a problem, it makes them feel unsafe. I don't know. I really wonder if you have thoughts on why people judge others so harshly when they have a.
I think one of the reasons why people judge is because they don't really understand. They don't really understand the whole concept of mental illness or mental health challenges. So for them, it's a bit alien, because the truth is, if you have a true understanding of how these things happen and how it is not the person's fault, you won't be talking to them and being judgmental and being say and say you won't be saying stuff like, why you, this is such a little thing, I've been through worse and I didn't break down, so why are you being weak, why are you being that? Because a lot of people don't understand. But if we all understand that, number one, we're all different. Number two, we have different emotional resiliences. Number three, these things are real, mental illnesses are real. Once we have those basic understanding, we'll be able to operate from a higher level, a non-judgmental level. But people really judge what they really don't understand. That's the summary of it. People judge what they don't really understand. And that is why we are here to raise the awareness about mental health and mental health challenges, that these things are real, these things are actually real, and they can happen to anyone. So that the more people understand it, the better they are able to show support in their way to people around them. More people will be kinder to, show kindness to other people around them. So the first thing is to get people to make sure they understand this whole concept. And once that happens, you see that people will be less judgmental.
No, no, I was going to say, what else? How else can we show support and
Okay, okay. So also, follow up is important. Follow up is important. Let's say that someone comes to you, confides in you, and then they decide, okay, I think I should go to therapy, and then they're like, or you recommend, I think you should talk to a specialist, you should talk to an expert, and they're like, okay, fine, I will. Okay, when do you want to go? Do you want to go Friday or whatever? Just make sure you follow up. Ask them the following day. Oh, the last time we spoke, I remember you said you go to a therapist on Friday. I just wanted to know, were you able to go and how did that go? Just following up so that person knows that you actually care and you're concerned about them getting better, as opposed to just leaving it. You won't talk to them again. So just that follow up, even during the follow up, you might find out that the person even eventually didn't go because they got afraid. And that's another avenue for you to just encourage them further, that okay, you don't need to be afraid. Therapy would be useful for you. So just try to make sure you go. If you need me to, come with you, let me know, or show you support or something like that. So that follow up alone is very important. And if you check all these things I'm mentioning, it's the barest minimum anyone can do, and it's the least anyone can do. I'm not saying that, oh, turn to a therapist for your friend. Just showing the support, showing that empathy, and showing the care will really go a long way in helping anybody around you. And then I do know that some people, even with all the support they have, they usually don't want to get help. Those situations are a bit tricky, and then it gets so bad that the caregiver or their support group will get frustrated because they'll get tired of helping them and all that. But in situations like that, just try to keep encouraging them. Because the truth is, someone who is very adamant of going to therapy or not getting help, there's a reason for it. They might not be comfortable enough to share that reason, but just try to reason with them that, okay, there's a reason why they are being this difficult. But you just have to keep showing them the love and care. Don't get tired. Sometimes it might be tiring because I've heard stories of clients relatives that get frustrated, even despite the fact that they show so much support. The clients might not really go for help and all of that. It can be frustrating. But what I would say is that just try to keep encouraging them, because one day they will eventually go. There's a reason why they are being so adamant and being so difficult, which we might not be able to understand. But what we can do is just to continue to show the support, continue to show them that we care and we're there for them. That's the best we can do.
I would also say, like, for the caregivers to find a way to also take care of themselves
It's
while they.
very important.
Mm,
Very
yeah,
important.
yeah.
Very, very important.
Wow. Very powerful messages. Would help us all, right? You talked about comparison, like not comparing, oh, this person went through it, and why are you? Yeah, they say, what do they say? Comparison is the stealer of joy. It's the same with kids, right? They're not comparing siblings. Oh, your sister is better than you. Why are you not like your brother? And we do that so much. Your
Yes,
your
coming
mate
from
has
Africa,
been
yeah,
your
from
mate has
where
been
we're
able
coming
to.
from.
What are you doing? Like we tend to just throw it out like that, and it's really it's something we have to eliminate, not only for kids but even for ourselves. Yeah, comparison, comparing people, because everybody, as you said, everybody has their level of resiliency, and they will take things. Yeah, they will perceive things from how they are, and that's we can only support. Thank you so much.
Yeah.
We're going to start winding down. Now
Okay.
I'm going to bring it back to you. So
Okay.
how do you take care of your own mental health?
Okay. So for me, I there's so many things I do. I try to take out time just for myself to take care of myself. Sometimes I cook a very nice meal, just eat and feel relaxed.
What
I
do
may
you
watch a movie. What?
what do you
I may just look for a very fancy recipe online and just try to make it something I've never eaten before. Just try to cook it. So for me, cooking new recipes are very exciting. I find it exciting. And another thing I do is I could watch a movie. Sometimes I listen to podcast. I could read a book. I could talk to my family and friends, just catch up with them. And now that, so I really don't remember what I used to do pre-COVID because it's been so long. So I'm talking about in this COVID era with lockdown and everything, you can't really go out much. But I know that, oh yeah, I just remembered I find swimming very relaxing actually. So that's another pre-COVID activity I used to do. I like, hanging out with my friends, meeting up in cafe and just relaxing. And for me, I just take out time to pamper myself. When I feel like I'm getting too stressed, I take a step back. I'm like, okay, wait, we need to relax, we need to calm down. What am I going to do? Sometimes it's just a nap I need. Turn off all my devices, turn off my phone. I don't want to communicate to anyone. I just need 30 minutes of, peace and quiet. So sometimes that really helps. So there are different activities I find. I'm still in the market to look for more activities that can help my mental health. So I'm always open to trying new things and all of that. But I always make sure that whenever I feel like I need a break or I need to take care of myself, I always make sure that I try as much as possible to make sure that I take out time for that because it's very important.
what book are you reading, or what's the latest book you've read, like the last book?
I'm currently reading The Compound Effect. I can't
Hmm.
remember the author, but it's about
Is it about habits and how?
oh no, it's about money, like it's a financial book about how basically the idea of the book is the compound effect. So you saving $2 now, think about how much you would have saved in 30 years time. The compound effect of saving $2 every day for the next 10 years. Think about what that would be in 30 years. So just thinking about the compound effect of every decision we make right now every investment you make right now, the compound effect of that, every money you lose right now, the compound effect of that. So that basically is just, it really puts things in perspective for you because it helps you to think about the future, because if so it's like if you spend $40 on something now, what's the value in 10 years and all of that. So that's basically what the book is about. I'm not done, but that's like the premise of the book.
Hmm. Really like that. I like that idea. Even like investing in your health, like taking care of yourself, the compound.
Yeah, the compound effect of taking care of your mental health right now. What would that look like in 10 years? What would that look like in 30 years? So stuff like that. Yeah.
It sounds very encouraging. Yeah.
Yeah, it's really good.
Yeah. And what podcast do you listen to?
Oh, I listen to a lot of podcasts. I can't even, there's so many. I listen to finance, I listen to um, religious podcasts, I listen to just knowing how to do stuff, some random facts about the world, about Earth, you know, different different podcasts about relationships, so many things, so many. So I like to just have a mix in my library. So today I'm like, oh, I feel like listening to something about finance. I feel like listening to something about your health. I feel like listening to something about mental health, and then also have the career ones that I listen to. The ones about the society, the psychiatry society, psychology society, all of that as well. The career ones are there. So really, is a mix. I like to just mix it up and listen to all sort of things.
I think every idea I have in my mind about something I want to learn, I first start by looking for a podcast. Then after I go to YouTube, to see stuff. And they'll say, okay, let me look for a book, if I'm really interested. So yeah, there's a lot of knowledge out there. Yeah. Before we wrap up, do you have any last thoughts for our listeners who will be listening to this episode?
Okay, so just to reiterate and summarize everything we've said today, um, mental illnesses are or mental health challenges are common, and if you find that you really need help, please seek help because help is available. Don't feel stigmatized. Don't feel like you're all alone because you're not all alone. Just seek for help. Help is available, and you will definitely get better. It will definitely get better. Things will get better no matter what it is. Just seek for help.